This segment is sponsored by Reunion Neuroscience. A cancer diagnosis doesn't just affect the body, it deeply impacts emotional health. Today we're discussing adjustment disorder and why mental health support is critical for patients facing serious illness. Here to share how a new clinical trial could help redefine cancer care by addressing the emotional toll alongside the disease is Dr. Manish Agrawal, board-certified oncologist and co-founder and CEO of Sunstone Therapies. Welcome to Great Day Washington. Thank you so very much for being here.
Thanks. Glad to be here.
Of course. For anyone who's unfamiliar, can you explain what adjustment disorder is?
Sure. Adjustment disorder is quite simple. It's a mental health condition that can develop when in response to a stressful life condition. And so if you get a cancer diagnosis, MS, anything like that, obviously it causes a lot of stress and people can develop adjustment disorder from that. And symptoms from that can be like sadness, anxiety, sometimes feeling overwhelmed, things like that.
Sure. Dr. Agrawal, why is it so often overlooked?
You know, it's something I've thought a lot about. I'm an oncologist for 20 plus years, and mostly in medicine we focus on the physical parts of cancer. And so I talk about this collusion of denial. You know, you go to the oncologist's office and practice for 20 years and you know, how are you? I'm fine. And we focus on nausea, vomiting, your physical symptoms, but not really on the impact the cancer has had on your personal life. And so it's easy to overlook, and there's not a lot of room for people to talk about those sorts of things.
Yeah, that makes sense. And why is talking about the mental health of patients just so crucial for their diagnosis and for everything, the outcomes?
Yeah, I mean, so as an oncologist, what I saw over the years is I got really good at treating the cancer, the physical symptoms, but the quality of life was determined by the emotional health. And so people could be physically feeling okay, even cured of their cancer, and still really not feel like they could get back into normal life. And so addressing the emotional health is really important in terms of people feeling better. You don't want to just be rid of your cancer or have your cancer treated. You want to feel better. Yeah,
that makes so much sense. It's such an emotional toll as well, and I can imagine that even when you're treated, you have gone through something that's been really traumatic for yourself and for your family.
That's right, and a lot of times patients will report, you know, like people look at me and, you know, my hair's growing back, I look okay, but I feel terrible, and things don't make sense anymore sometimes, like the relationships they have, the friendships even work, and so because you've been through something, you need a way to process that. And a lot of times in medicine, we're not trained to really focus on that part of someone's care.
Sure. How is adjustment disorder currently being treated?
You know, there's really not, most frequently it's not treated. And so most physicians aren't looking for it, most patients aren't talking about it, family members aren't talking about it. When it is treated, sometimes it's treated with talk therapy. There is no FDA approved treatment for it. Sometimes people use SSRIs, so there's not a great standard and frequently it's not treated.
But I understand there's a new trial. It's called Rekindle Phase 2 trial. Can you tell us more about that?
Sure, I'm really excited about it. It's a Phase 2 study looking at a novel investigational treatment called RE104, which is a short-acting psychedelic in treatment of adjustment disorder in cancer patients. And so it's combined with support and therapy, and it helps people process some of the difficult things with having a cancer diagnosis or a neurological condition like a MS or Parkinson's, and helps process some of the things that have happened with that diagnosis, helps find meaning again and able to continue on with their lives.
Wow. For anyone who might be listening right now, you might be really striking a nerve. They might have been experiencing this or know someone that does. What advice do you have for anyone who is struggling emotionally due to a cancer diagnosis or another health-related illness?
Yeah, I think the most important first thing is not to have shame around it. Sometimes there's still stigma and people feel like, oh, I should be stronger, I should focus on other things. And the first thing is to be able to acknowledge that this is a devastating illness. You lose meaning, lose control, start having symptoms, and your life changes. And so one is to first acknowledge that that's a normal response. It's not because you're broken or you're weak, but actually to normalize that, and then to seek help. And for some people it might be a study like this, some people it might be therapy, some people it might be meditation, but to start talking about it, bring it up with your physicians, with your family members, and talk about it.
Thank you for getting that conversation started today. I hope it continues. Thank you so much.
Thanks for having me.
Yes, of course. You can visit the Rekindle Study website at rekindlestudies.com or scan the QR code on your screen to learn more.